Report. This group is getting new COVID cases due to Delta. As an infectious disease, COVID 19 is expected to cause severe symptoms in those vulnerable, like people with chronic conditions and weaker immune systems. But the Delta variant has been changing the rules of war in this pandemic. The usual norms no longer apply and were replaced with new sets entirely. This is how dangerous Delta is in spreading the coronavirus and severe disease worldwide. Previously, only a few population groups were known to be vulnerable to COVID 19. Now, another group seems to be getting susceptible as well. Although more data is needed, a professional organization has advised people to take preventive measures more seriously. This is because the variant has surged the number of COVID cases among children too quickly in a week. According to the American Academy of Pediatrics, the total number of children that tested positive for COVID 19 since the pandemic began was almost 4.2 million as of July 29. However, in just a week, the total new cases were nearly 72,000, showing a fresh surge among children. That was higher than the almost 39,000 new cases reported in the week before. For the week ending on July 29, 19% of weekly reported COVID 19 cases were children. Since the pandemic began, children now account for 14.3% of all cases in the US. Parents should no longer assume that if their kids are healthy, they will be just fine. They must be vigilant against COVID 19 and its variants. So, how can parents protect their kids? The top answer is vaccination. This is not limited to protecting the child from COVID 19. Vaccines will also protect those around them. Even if they caught the virus, the risk of hospitalization and death is significantly decreased. Besides vaccination, parents should also talk to their kids about interacting with other children. If visiting kids aren't vaccinated yet, have everyone wear a mask for safety reasons. This is not to discriminate but to cut the potential spread of the virus. As per CNN, there are other helpful ways, such as outdoor plays, good hygiene, and social distancing indoors. Outdoor plays usually have better ventilation that limits viral particles to persist compared to indoor settings. Despite the scary idea, kids still need outdoor experience, and parents can do it with proper limits here and there.